Hello. So today we're going to talk about the cardiac action potential. So when we say cardiac, it is a type of muscle that is located in your heart. So the heart muscle is very remarkable. So at an average heart rate of 70 beats per minute, the heart needs to contract and relax more than 100,000 times a day without stopping or tiring. So the rate and the strength of these contractions must vary to meet physiological and pathological challenges. So today we're going to talk about the uh, the generation and spread of the action potential and the process and excitation coupling of your cardiac muscles. So myocyte is the cells of your heart. Okay, so you call the cells of your heart as myocytes, and there are two cardiac action potential that is happening in your heart. So the first one is a non-pacemaker action potential, and the other one is a pacemaker action potential. So the non-pacemaker, these are also known as fast response action potential because of rapid depolarization. It can be found all throughout your heart except for the pacemaker cells. So all of the muscles that is located in your heart, so these cells are responsible for the fast response action potential, while your pacemaker is also known as the slow response action potential because of slower rate of depolarization. And it can be found in your sinoatrial and atrioventricular nodes. So both types of action potential in your heart differ considerably from action potentials found in your neural and skeletal muscle cells. So one major difference is in the duration of the action potentials. So in a typical nerve, the action potential duration is about 1 millisecond, while in your skeletal muscle cells, the action potential duration is approximately 2 to 5 milliseconds. So in contrast, the duration of cardiac action potential range from 200 to 400 milliseconds. So as you can see or as you observe, your heart contractions happens very fast. So now let's discuss how the action potential happens in your non-pacemaker cells. Okay, so um, the work of cells have a large stable resting membrane here, and it display a prolonged action potential that has a plateau stage. So the first one, the main ions involved here are your potassium, sodium, and also calcium. So firstly, so let's have a look on the typical cell or your myocyte. So let's um, get one cell of your heart. So in the cells of your heart, you have this gap junctions, okay, where the exchange uh, of ions are are happening here, and also we have your channels. So that is in different colors because it depends on the specific ions that that will enter or exit your cells. Okay. So first one is you have your um, potassium that leaks out of your cell. So this is normal. Okay. So in your resting membrane potential, this is normal. Potassium is leaking out. So the resting membrane potential here is negative 90 millivolts. Okay, so you have potassium leaking out, and then in your gap junctions, you have your sodium leaking inside your cell. So the movement of molecules is from high concentration to low concentration. And we tackled earlier that in the amount of sodium outside your cell is higher compared to the amount of sodium inside your cell. Now, the movement is from high concentration to low concentration. That's why sodium leaks in inside your cell um, through your gap junctions. The next one, um, since since you are increasing sodium inside your cell, then you're going to increase um, the membrane potential of your cell. So it will reach now the threshold. Okay. So the threshold here is negative 60 millivolts. Okay, once you reach the threshold, then you're going to open your sodium gated ion channel. So you're going to increase more sodium inside your cell because there are also um, sodiums leaking inside your cell through your gap junctions. So more sodiums inside your cell, then you are making your membrane to become positive. Okay, so so when you reach positive 10, then um, it will close your sodium gated ion channel and it will open another channel, which is your potassium gated ion channel. So when potassium gated ion channel opens, you are leaking out more potassium outside your cell, which makes your membrane to become near 0 millivolts. So um, so after some time, um, you will open another gate. So after some time, this ion channel will open, and that is your calcium gated ion channel. So you have more calcium going inside your cell, and you're also leaking out more potassium outside your cell. So there are ions going in and ions going outside your cell, which makes your graph to become straight. So this stage is called your plateau stage. Okay, so remember the types of land formation, that a plateau is like a mountain, but it is flat on top. So that's why this this is what they call this stage. Okay, so now then after some time again, this calcium gated ion channel closes, leaving potassium gated ion channel um, opens. Now, uh, if you're going to leave your potassium gated ion channel open, then you're leaking out more potassium outside your cell, which makes your graph to become more negative until you reach the resting membrane potential. Okay. Now, in your non-pacemaker action potential, we have four phases. So we have um, the resting the resting potential or the resting membrane potential is phase 4. So phase 0 is depolarization. Phase 1 is early repolarization. Then phase 2 is your plateau stage. And phase 3 is your repolarization. Okay? So as you observe, so it kind of resembles your neural action potential or the um, skeletal muscle action potential. Okay. So remember that a non-pacemaker action potential lasts about 300 milliseconds. For for the vast majority of this time, the cell is absolutely refractory to further stimulation. In other words, a further action potential will not be generated until repolarization is virtually complete. So this prevents tetany from reoccurring. So if a supramaximal stimulus occurs during the relative refractory period, the resultant action potential has a slower rate of depolarization and is of smaller amplitude than normal, so producing a much weaker contraction than normal. Now let's um, see now your um, pacemaker action potential. So this pacemaker action potential, the responsible cells here are your pacemaker cells. And pacemaker cells are unique because they um, they make your heart beats in a unison. So that property is what we call automaticity. So your pacemaker cell has this type of property, automaticity. Okay, and your pacemaker cells, we have three types of pacemaker cells that is located in your heart, namely sinoatrial node, atrioventricular node, and bundle of His or Purkinje fibers. Now, these cells are located here. So this part is your sinoatrial node, and then this one is your atrioventricular node that is located in between your atrium and your ventricle. Then we have in your septum we have your bundle of His, and then in your the apex of your heart, the apex of your heart, we have your Purkinje fibers, and we also have the minor cells here, which is your Bachmann's bundle, and then internodal pathways, and the left and right branch that separates your left and right ventricles going to your Purkinje fibers. Okay. Now, how does the pacemaker action potential happens? So, um, let's have a look again on your cell of your pacemaker. Okay, so here, sodium is leaking inside your cell through your sodium gated ion channel. Okay, so if you're going to increase more sodium inside your cell, then you're going to make your membrane to become less negative. So the membrane potential here is also negative 90. Okay, so when you reach the threshold, you will open another channel. But sodium gated ion channel will also open, and then on this stage, you will open two channels. Okay, so the sodium gated channel and the calcium gated channel, causing the entry of sodium and calcium inside your cell. So these ions will make your membrane to become positive. So the graph will go up until you reach positive 10. And then when you reach positive 10, it will make your calcium gated ion channel closes and then opens your potassium gated ion channel. So when you closes your calcium gated ion channel, automatically calcium cannot enter your cell. So if you're going to open your potassium gated ion channel, then potassium will leak out of your cell because we have high amount of potassium inside our cell, and we have low amount of potassium outside our cells. Then the movement is from high concentration to low concentration. So potassium is going out. So if we're going to leak out of our potassium, it will make our membrane to become more negative until you reach the negative 90, and this cycle continues. Okay, so remember that this phase here is one heartbeat in 1 second. That is happening a one heartbeat in 1 second. Okay, and the phases here uh, is 4, 0, and 3, which is your resting membrane that is going up, slightly going up there, and your uh, depolarization stage and your repolarization stage. Okay, so as you observe, the pacemaker action potential differs from the non-pacemaker action potential in phases in their phases. So phases 1 and 2 are absent here. The heart displays automaticity, which makes your heart to contract in a continuous manner. So the pacemaker cells do not have a stable resting action potential, and it is the spontaneous depolarization of the pacemaker potential that gives the heart its automaticity. Okay, so the pacemaker potential is produced by a decrease in membrane permeability to potassium and a slow inward current because of calcium influx, and then an increase in sodium current because of sodium calcium exchange. Then once the threshold potential is reached, then the calcium channel opens, then calcium ion enter, depolarization occurs. So in contrast to the non-pacemaker cells, or the non-pacemaker action potential, um, there is no inward movement of sodium ions during depolarization. Okay, so repolarization occurs because of an increase in potassium permeability. So at the sinoatrial node, potassium permeability can be further enhanced by vagal stimulation. So this has the effect of hyperpolarizing the cell and reducing the rate of firing. And sympathetic stimulation has the opposite effect, of course. Now, the question is, how does the reuptake of calcium in your sarcoplasmic reticulum? Okay, in order to bring back the lost calcium or the lost ions inside your cell. So, just like your skeletal muscle cell, then the sarcoplasmic reticulum will also reuptake um, calcium, the lost calcium, um, with the help of catecholamines. Okay, so these catecholamines activate beta adrener. So with the help of catecholamines, phosphorylation of myosin also occurs that increase the rate of cross-bridging cycle. So it also increase the rate of reuptake of calcium into your sarcoplasmic reticulum and also aids for relaxation. So catecholamine here has a greater um, role for reuptaking and for increasing the rate of the cross-bridging and for the relaxation process of your cardiac muscles. Okay, so this ends our topic, and I'm hoping that you learned something. Thank you for listening.